It's back. Yes, COVID is rearing its ugly head again. Throughout late May and early June, the COVID pandemic appeared to be on the way out, specifically as it relates to the United States. But in recent weeks, a new variant of the virus called the Delta variant is spreading through the US and is taking over in some states. The rise of the highly contagious COVID Delta variant is causing increases in new coronavirus cases, hospitalizations, and deaths in parts of the country from south to the west, prompting increasing concerns about the deadly impact of the virus, particularly on unvaccinated communities. What state do you think is the worst off for the Delta variant? And what can you do to protect yourself? Answers coming up next.
Live from Los Angeles, this is the Special Report with Areva Martin.
The Delta variant is a more transmissible and dangerous strain of coronavirus. It now makes up more than half of all new COVID 19 infections in the United States. In Kansas and Arkansas, the variant is responsible for 84% of the cases. And in my home state, Missouri, it is the cause of 96% of all new cases. Now, according to the nation's top doctors, Dr. Anthony Fauci, the variant poses a significant threat, including hospitalization and death to unvaccinated people, which at this time is more than 50% of all Americans. Now, President Biden and health experts' efforts to vaccinate at least 70% of Americans by July 4th failed. Millions of people across the country are refusing to get vaccinated despite the availability of the vaccination. Drugstores and healthcare clinics are reporting thousands of missed appointments and excess vaccines. See, they're no longer just people who are hesitant. They are outright refusing. Lots of people are outright refusing to get vaccinated. Celebrities, White House, and public health officials are pleading and even begging people to get vaccinated. But in many states, these pleas are falling on deaf ears. Today, we are asking why and how is the conduct of these folks who are refusing to get vaccinated impacting you and your family? My first guest is Adrienne Johnson. She is a nurse in Louisiana whose emotional plea in 2020 about the virus went viral. She's joining us this morning. Good morning, Adrienne.
Okay, good morning. I apologize about that.
No
Good
problem.
morning.
Thank you so much for joining us this morning. I know it's been almost a year, but I can't help but think back on that very emotional Facebook video that you recorded about what you were seeing as it related to how the COVID-19 virus was impacting patients that you were caring for in a long-term care facility in Louisiana. I want to play a portion of that video and talk about it on the other side.
The virus is real. I see it with my own eyes. It's attacking people. Like, some amazing things I've seen, and you can't help them when they short of breath. There's nothing that you can do. They keep them comfortable. It is absolutely nothing that you can do. When I say nothing that you can do, they breathing like this. How they breath. And they can't get words out. And there's nothing that you can do if there's not a ventilator at a hospital ready and available for them. There's nothing that you can do. I can't sleep.
Wow, Adrienne, that video goes on for about 12 minutes, and in it, you just tell the horrors of being on the front line, watching people. And I see even watching it today makes you tear up, and it's just heartbreaking for me. Just tell us what was going through your mind when you decided to record that video.
Um, On that morning, me and one of the fellow CNAs that was working on the COVID unit with me, she was telling me about her grandmother and how she was just put on a ventilator, which she in return she eventually did pass. And I was speaking with her about how my aunt, who had diabetes, was about to stay with my mom, who also had diabetes because she had contracted COVID, and my mom was the only local sister that was available to take care of her. So with us not knowing as much about the virus, me and her was just fearful as to what was to come. So our morning started like that, and I simply just stepped out for a fresh of breath air. And I said, well, let me reach out to my Facebook friends and just tell them about it. And then all of a sudden, the video went viral, and I'm glad it did because I think it woke a lot of people up.
Yeah. In the video, you start by saying COVID is real and you can see it and you point to your own eyes. Why was that so important back then, you think, to say?
Because you know how you were just listening to the news every day and you were getting bits and pieces. You were hearing about pleurisy, you were hearing about just bits and pieces of COVID, not enough information. And then when you were like hearing about cheap flights, so that was exciting, but you wasn't looking at the fact that people were dying. So you're in like it was a thrill. And then eventually until I saw it with my own eyes and I realized that there was nothing that we could do but to keep this person as comfortable as possible was amazing to me. Because usually I could fix it. I can call in something or something could be done about any illness or disease that somebody was suffering with. But with COVID, nobody knew enough yet. And it was devastating because it was like you literally had no answers, not a solid answer. They were only trying things out to see what really worked. And it was devastating because you could not help people that you usually could help on any other day.
And did you at that time, Adrian, think that there were some people who didn't believe how devastating COVID was, and you were also trying to help them understand that
That's
this illness
correct.
is not something to play around with?
Yes. A lot of people on my timeline was, just on social media, joking, wasn't taking it serious until it actually hit home and they knew somebody who actually took sick to COVID or actually died from COVID. So I was just trying to pre-warn everybody, like stay inside, wear your mask and protect your family as much as you can because we were seeing it and it was starting to actually affect us personally. And we wanted everybody to stop the spread.
Wow. So now, I started the show, Adrian, by talking about, in the last couple of months, we were thinking we were getting, past the worst of COVID. States were starting to open up. States were telling folks they didn't even have to wear masks indoors and particularly outdoors. Now, in the last couple of weeks, we've seen, this Delta variant and this surge of cases, particularly in places like the South where you are, in states like Louisiana. So, how does that make you feel now, hearing that COVID is on the rise again, particularly in southern states?
For for me, I feel as if I'm double vaccinated, by the way. I took the Moderna vaccine. So with the Delta variant on the rise, I actually encourage vaccinations due to the fact that I had a cousin who was recently hospitalized. She is healthy as all can be. She went through the entire COVID season with no issues. She never contracted anything within a year and a half. And then all of a sudden, she's in ICU for about 7 days. And she's just in her younger 30s. So to see that, it actually encouraged her sister, who wasn't going to get vaccinated, to go ahead and get vaccinated. So I feel as if I'm more pushing vaccinations just for your safety because we don't know what's coming next after Delta. But if the people who are vaccinated have a less chance of getting the Delta variant, that's a good thing. So that means go get vaccinated so that we don't have to shut down again. You don't have to spend Christmas away from your family. And I have a really large family where we have almost 50 people in one house. So I want to have a normal Christmas again and Thanksgiving. And if we all do our part, and that's being vaccinated or staying inside if you're not vaccinated, it'll keep us all safe.
And thank you for saying that. Thank you for sharing that story about your cousin, because we're hearing too many of those stories about younger people in their 30s, in their 20s, who are hospitalized, but also who have decided that they're not getting vaccinated. And a lot of those people live in a state like yours, Arkansas, Louisiana, Mississippi, have really low levels of
Yes.
vaccination rates. What are you hearing from people, that not the cousin who's now decided to get vaccinated, but from those people who are saying, this ain't for me, I ain't doing it. What do you think is driving their decision, even though they know these stories because they've heard your video?
And they've actually had COVID before. So the ones who aren't vaccinated yet, they are afraid of getting it again due to the fact there is a different variant. They are afraid of the vaccine due to the fact that they feel as if I've heard a couple people say it's the mark of the beast. I'm not going to go into detail about that. And I've also heard people say that since it's not FDA approved, they're not sure what's actually being put into their arm. And I understand, but I also do trust God and I trust science. And I have a family that's full of a background in the science field, and they actually was just like, yes, we trust it. So I went with it. Once they gave me the okay, I went with it. And it's just conspiracy theories, and one person says one thing and everybody just runs with that same little storyline, and they're stuck in their ways, unfortunately.
Yeah, that mark of the beast. I know what you're talking about. So that's black church rhetoric that we hear
Yes.
growing up. Anything we don't have a good explanation for, we say it's the mark of the beast. So,
Correct.
and fortunately, black churches have, a lot of them, not all, but a lot have played a big role in trying to, roll out vaccines and encourage their congregants and their members to get vaccinated.
Yeah.
One thing your state is doing, with only 35% of the people fully vaccinated, they rolled out this incentive program, this actual lottery where people can win millions of dollars in the state of Louisiana. Do you think that's going to have an impact on some of those folks who are sitting on the sidelines, who, I don't know if we can call them hesitant, because some folks are just outright refusing?
I don't think so. Because they feel as if, why are they pushing it on us so bad? Like, and so then you have those, like, for them to do a lottery and where you can win money, something's not right. It's a lot of conspiracy theories. I don't think it's a good option. I just feel as if they don't want it, they don't want it. Time will tell. And I do not wish sickness upon anybody. But once again, I've seen COVID with my own eyes, and I wouldn't wish it on anybody. So
So you think the incentives, the free admission to the park, the money that you can win, you saying that's backfiring and having the opposite effect on people, and people are saying, "Oh my God, they're pushing it too hard. There must be something wrong with it."
yes, they feel like, why are they pushing it on me now? They don't know am I getting the same one that everybody else get? Are they trying to give us a cheaper version? It's a lot of conspiracy theories, and I just feel as if offer the vaccine, keep the vaccination centers available. Like I said, when they see a family member or somebody else contracted at this later time, at this time around, and we're going to go into flu season. So hopefully a lot of people get smart, because you have to wait 90 days after you contract it to get vaccinated. So that's rough too. And that's scary for people who've had COVID within these couple months, because they want to try to beat the flu season and the how the Delta variant is about to come back up. So it's nerve-wracking, but if people who had COVID can push it out and tell other people, please, please, those are the people who need to step out and help people get vaccinated. People who actually suffered from it and know that they were very close to death or felt like they were very close to death need to get out and promote the vaccinations. When you're hearing it from the government, it's one thing, but when you hear it from somebody who laid in a hospital bed, who's never even had a child and had to be in the hospital for 7 days, I mean, it's a big impact. It's a very big impact.
That is what you just said is so powerful, and it's so simple, but yet, I haven't heard it said a whole lot by, like you said, the government and people in charge of this messaging. We've heard, they've tried to push celebrities, they've talked about pastors, they've had the president, the vice president, but I don't think there's anything more powerful than someone, like you said, that's been in that hospital bed for 7 days, 14 days, 21 days, speaking about what they experienced. And I'm thinking now of a family member, just like your cousin, whose brother, young 30-year-old guy, was in the hospital for over 2 weeks. Family was not getting vaccinated until they had to go visit that brother, face the fact that he was near death,
Yes.
And one of the sisters got involved and championed the cause, and now that whole family has gotten vaccinated and standing in solidarity with their brother, and recognizing that they almost lost their brother. That was
Correct.
more powerful than a governor, a mayor, a LeBron James, or any celebrity on this planet was
Yes.
moving them in the way that personal experience touched them in the way that you described happened to your cousin. Before I let you go, I want to ask you about yourself. One thing you said in that video was just how stressed you were being on the front line. For one, I want to thank you as a frontline worker. It
Thank
was
you.
people like you all over this country that helped us get through this. So we owe you, a large debt of gratitude. But how are you feeling now?
I'm better. COVID is down here in the Shreveport area, so we don't have. I used to work on a COVID unit up until about, I think it was the end of January. So I haven't encountered throughout the facilities that I go to, due to the fact I'm working agency, I haven't encountered any COVID units in those long-term care facilities. So I am better because I'm now getting back to actually being a nurse where I can sit and talk with my patients without being, geared up from head to toe, sweating and just trying to do my best. Now I'm able to be the nurse that God has blessed me to be, and I can still give out more. I can give out more passion and more of my time now due to the fact it's not as hectic. So we're getting back to the norm where we're having entertainment in the facilities and things are better. So it's suppressing, and I'm in a better headspace now. I actually did counseling after that video to help me maneuver through life and manage my emotions. So I did do a lot of self-care.
Wow, that's excellent. And I take it you're getting more sleep these days?
Yes, yes, yes,
Great.
yes, ma'am.
Well, Adrienne, I want you to sit tight because I want to bring you back on a little later in
Sure.
the show when we're having a discussion, particularly around the Black community, because it's so important. Our community in particular has been so disproportionately impacted by COVID. So thank you for now, but sit tight, and I'm going to have you come back. Justin will send you a text. But I want to move on now because we're talking about this Delta variant, and a lot of misinformation and confusion about what it is and what it isn't. And we have one of the nation's leading researchers and doctors in the country joining us now. His name is Dr. Eric Topol. He's a cardiologist and a scientist. He's the founder and director of Scripps Research Translational Institute, and he was an advisory member of the COVID tracking project. Good morning and welcome to the show, Dr. Topol.
Thank you. Great to be with you.
Well, I read somewhere, Dr. Topol, that you're one of the most influential researchers in the country. So we are looking for you to answer all of these tough questions about the Delta variant. So I'm just going to start by asking you, what is the variant, and is it worse than other variants that we've seen?
Right. Well, thanks, Areva. I think you can say for sure this is the worst version of the virus we've seen since the whole thing started at the end of 2019. The reason it's the worst version is because it is so contagious. So the Alpha variant, which was found in the UK, which was certainly more transmissible, that was about 50% more transmissible. This is another 40-50% beyond that. So beyond that issue, there's also the fact that it takes 2 vaccine shots to get the desired efficacy. So it's basically a combination of the worst features of the virus, that it's much more contagious, a super spreader strain, if you will. And it also challenges our vaccines to some extent. They work really well, but not just with 1 dose. And so this is what we need to do now to get ourselves to prepare this Delta wall, which is not sufficient right now in the United States. We don't have enough vaccinations, we don't have enough protection, but we have the tools to do this. That's the real mismatch.
You wrote in your recent op-ed piece in the New York Times, Dr. Topol, that the variants don't have to be scary. It was a nice, catchy headline, but I don't want to read too much into that headline. What did you mean, though, when you said that the variants don't have to be scary?
Right. Well, sometime earlier this year, I had termed the scariant, the term for that there's lots of variants, thousands of variants. Most of them are meaningless. They have no functional significance. But this one, Delta, it clearly is, it could be scary, but the point here is we can squash it. We can make it not scary. But what it means is people have to get vaccinated. And when there is an area where there's lots of Delta COVID, like there is right now in Arkansas and Missouri, especially, people need to be very careful. So we know how to block the effects of Delta. This is the one toughest variant for sure, but we're not doing it very well.
Why do we keep getting these variants, and why do they keep getting more contagious?
Right. Well, the Delta variant actually emanated out of India. And as you will recall, a couple of months ago, it was raging. The virus was just spreading throughout India, the second largest country in the world, of course. So it basically evolves because it wasn't contained. And all these variants, that's basically the story. The ones that have cropped up and seen first in the UK and South Africa, Brazil, each of them were after very sustained, rapid growth in those countries, basically without containment. We've never had full containment here in the United States. So this is the problem. If we don't get this thing under wraps, contained throughout the globe, we're going to see more variants over time.
As a researcher and a scientist, are you all, is your field, the professionals that work in your field, are you able to tell in advance which of these variants are going to cause more hospitalizations and even deaths?
No, that's actually one of the issues. A lot of times there'll be a headline about the double mutant or the Delta plus, and we don't really know until we see in the lab, whether it can escape our immune response or how well it can spread, which, you have to look at things like household contacts and, what's happening over time. And right now, for example, countries that have had a very high Delta dominance, like the UK and Israel, we're learning every day about what is it that protects people versus those that's keeping them in jeopardy. So, it takes a while to really understand a variant, and there've really only been 4 since the beginning of the whole pandemic that became issues. The rest of them have basically gone obsolete because they didn't compete. They just weren't transmissible enough to compete with things like Delta.
So you mentioned that there have been 4, and I remember having conversations with scientists and doctors about the variant from Brazil, the one. So what happened to those other 4? Are they still raging throughout the country?
Yeah, so that was the Gamma variant, so-called P1 out of Brazil. Basically, it was a challenging variant. It didn't transmit like this Delta, but it has been petering out. Basically, the whole globe is going to be Delta variant pretty soon. It's getting close right now. And so the other 2, besides the one in the UK called Alpha, the South Africa variant, Beta, it's also fading. In fact, even in South Africa, which is going through a really hellish wave right now, their 3rd wave, it's due to the Delta variant. So the variants, as they evolve, they can get more fit, and they basically can outrun the other variants. The question is, can humans outrun the variants? And, Israel's doing really well, but a lot of countries are not, and we're kind of in a very iffy zone right now.
Do you feel like, Dr. Topol, the information that's being disseminated to the public, for me, I feel like we're playing it down. I know you said in your op-ed it doesn't have to be scary, but sitting here listening to you, it sounds really scary to me. But I feel like we're getting these mixed messages because, businesses and government want us to get out there and spend money and enjoy the 4th of July and other, summer activities. But you just said the Delta variant is taking over the world, essentially. So I don't know. Is there mixed messaging that's harmful at this point?
Well, I mean, the sad part is if we did more proactively, there doesn't have to be any significant sequela from this variant. But we're not taking it seriously enough. For example, here in the US, we haven't gotten full approval for the vaccines that have been given to hundreds of millions of people and have had 7 months of review at FDA. If that were the singular thing that could be done right now, that would lead to millions, tens of millions of more Americans getting vaccinated who are holding back. But, there's so many things that we could do. And it's just unfortunate because there's just no reason that there should be any suffering, any issues with this variant, because we are fortunate enough to have the tools, especially in this country where there's a excess of vaccines. You know, it's not like places that are, you know, so short and have only 1% of their population vaccinated. We could get there, but we're not doing it, and that's the frustrating part. The communication, you know, has been soft. Please go out and get vaccinated, but the urgency of the matter and the ability for us to completely negate the variant's impact, I don't think that's been adequately, that word hasn't been adequately communicated.
Yeah, it's interesting you say that because Adrienne, my earlier guest, said that that's one of the things she's hearing from people is that this, uh, vaccines have not been given full approval, that they're in this
Yeah,
temporary state, and that people are less confident in them because they don't have full approval. And you just said that's the single most important thing that can be done. But I do hear people also say they worry about the efficacy of the vaccines because they were developed before the Delta variant. Is there any concerns about the efficacy given that Delta comes after
right.
vaccinations, that started earlier in the year?
Yeah, that goes back to something pointed out earlier, and that is, well, you're absolutely right. The vaccines were developed before there was such a thing as Delta version, right? The strain. But as it turns out, we're so damn lucky because the mRNA vaccines, the Pfizer, Moderna, are so potent that this variant Delta doesn't pose a significant challenge. It does with just one dose. There's a drop off in some of its efficacy, but when the people who've had these vaccines, and now it's been tested thoroughly, they get both doses. They're 2 weeks post their second dose. They're good to go. It's just as good efficacy essentially as all the previous versions of the virus. So we're lucky. Our luck could run out over time if we don't get this under control.
Right. And what about teens, Dr. Topol? So we know that some teenagers, I think if you're 13 and over now, you can get the vaccine. But are there safety concerns for kids? And given where we are, should all kids be able to get vaccinated by now?
Right. Well, I do think that it's really smart to get teens vaccinated. There's been a controversy, as you know, because of this rare myocarditis, heart inflammation that occurs in teenagers. It's quite rare, but the benefits of the vaccine, insofar as protecting the teens, as well as all the other people that they connect with in their network, their adults, is overriding. The benefit is so far overwhelming the small risk. And also the myocarditis, this inflammation, it's almost always very mild. It's very rare for this not to be self-limited. So not only is it a rare side effect, but it's rare for it to cause any durable problem. So for that reason, I really think getting teens vaccinated will help us, will help them, and will help everybody they connect with.
And I want to talk about, the mixed messaging on mask. We've been all over the board in terms of wear one, don't wear one, outside, indoors, and now there's a new debate specifically with respect to this variant. We saw LA County that the state of the state of California comes out and tells us if you're vaccinated, you don't have to wear a mask indoors. And I don't think it was a week later that the county health official in LA County, the largest county in the country, says, well, we're worried about the Delta variant, and even those vaccinated people should still wear a mask indoors. So people are really, really confused about what the rules are and what the rules should be based on the science. So help us understand that.
Yeah, no, really good point, Areva. This issue is because we're trying to dumb it down and just say, masks for everybody, this or that. It just turns out it's not that simple, unfortunately, right? Because let's say you're immunocompromised, you should be wearing a mask, period. Even if you're vaccinated, even if you've had 3 shots, you should be wearing a mask because you may not have the desired full vaccine response. If you happen to be in Arkansas or Missouri or Nevada, where these high growth of COVID rates of Delta are occurring, I'd wear a mask even if I was vaccinated because vaccination is not 100%. It might be 93 or 95%, but it's not 100%. But if you're in a place where, things are very good order and you've been vaccinated, there's no issue in your region, that you're good to go. But if you're not vaccinated and you haven't had prior COVID, you are just have a flashing sign on your forehead, you're going to get Delta. Your likelihood is going up, every day. So that's why, prior COVID, it's a different, there's some protection there. But if you haven't had it confirmed prior COVID, you haven't been vaccinated, you got a real liability.
But in the state of California, we were one of the states that had one of the lowest positivity rates. So we were doing great. We were like, poster child for how to handle COVID. But then our county health department is saying if you're vaccinated, you still need to wear a mask. So that seems to cut against what you just said. We're not Arkansas. We're not Mississippi.
Yeah.
You're in San Diego, so you know the back and forth in California. So why in LA County? If we are in such a good state in terms of low positivity rate.
Right. Well, the problem is it looked great. I mean, LA County was the biggest county in the country, was the best, right? And we were heading down to zero. We were in the 0 something decimal point. The problem is it started going the opposite way. And so we know that we have this jeopardy. The mask thing, I think, still applies. If you're outdoors, this is a non-issue, right? But if you're indoors in a place where we're starting to rise, it might be prudent, but it's really up to the individual. I mean, I don't think that if people are vaccinated and they're making a quick stop in a grocery store in LA County, that's really not the issue. But, if you have prolonged contact, it's poor ventilation, you don't know who the other people are in the room. Yeah, I mean, if you're in LA County, because what's going to happen, everybody knows this, we're going to be going up. It isn't like the people in Arkansas, Missouri, and Nevada stay there, right? The spread is going to continue. We're going to go through a countrywide wave. Hopefully won't be that bad, but we have lots of mobility in this country. And so California, while it was looking great, it's not going to stay looking as good as it was just a few weeks ago.
And just a quick example, Dr. Topol, of what is an indoor space where you would recommend someone wearing a mask even if they're vaccinated. Is that a movie theater? You just said it's a quick trip to the grocery store, not so much. But what if you're watching a 2.5-hour movie inside a theater where there's no open window or open door?
Yeah, no, the longer you're in a place, like you said, and the worse the ventilation is, the more concern. So, I actually wouldn't go to a movie theater right now. Okay. I'm waiting for this pandemic to clear before doing that. But everybody has to make their own decisions. This idea that we have this magic rule for everybody, it doesn't apply. We all have some intelligence about what is best for us. I wish people would get smarter with respect to knowing that we're so fortunate to have these potent and safe vaccines. If we did that, a lot more things basically would be less of an issue. You still could go to these places, and your chances of ever getting an infection, even in a movie theater for hours, if you're vaccinated, is very low. So, I think our problem is the choices that people have been making, with over 45% of people not fully vaccinated still. It's not great.
Yeah. Well, just final question. What's the single most important thing anyone can do? You already told us what the government needs to do, but what can, individuals and their families do to protect themselves? Obviously, it's getting vaccinated, but is there anything else that we should be doing?
Well, as you say, there's the number one V for victory is vaccination. But otherwise, I think trying to work with our networks of people to convince them that the science is there, that there's nothing to be afraid about. I wish TV would stop showing people getting needles in their arms. I mean, really, is that really necessary? But people have, needle phobia. That's not helping. But no, I think what we can do is try to convince our fellow, our friends, our neighbors, our family who are holding out. No, this is really good for everyone, not just for you who get the vaccine, but for everyone, because that's our most powerful tool for sure. And, around the world, we are sitting pretty. We have an oversupply, in fact. And why not get it into the, people that really will benefit?
Well, on that note, I've got to say goodbye to you, but thank you so much, Dr. Topol. Such, incredibly helpful information, and really appreciate the work that you appreciate the that you wrote, and continue to be a voice to help us get through this, because I can't even imagine going back to where we were 10 months ago, 12 months ago, the lockdowns, the quarantines, the wiping everything from money to, bread wrappers. So that was
I don't think I don't think we'll go back, but we could certainly do better going forward. So great to join you. Thanks very much for having me, Areva.
All right. Thank you again, Dr. Topol. Okay, you heard one of the nation's leading researchers and scientists say we've got to do better. My next guest is on a mission to make sure that happens, specifically with respect to the African American community. His name is Dr. Georges Benjamin. He is an internist and executive director of the American Public Health Association. Good morning, and thanks for joining me, Dr. Benjamin.
Hi, thanks for having me.
You, like Dr. Topol, also wrote a very powerful op-ed in the New York Times. And as you can see, I read the New York Times a lot, so that's where I get a lot of my guests. Your piece, though, you joined prominent Black doctors all over this country urging African Americans to get vaccinated. What prompted you, Dr. Benjamin, and your co-author to write that piece?
Well, we wanted to make sure that professionals of color were seen and heard. As you know, there were not very many voices or faces that look like me speaking to communities, and to the fact that we could certainly add our voices, and hopefully people would hear us maybe differently than they would hear others, we thought was very important.
And one of the things you say in the piece that I found really important is that disinformation or misinformation about the virus and about vaccines have pervaded social media and have really had a negative impact on the Black community, a community that, as we all know, and we've talked a lot about on this show, has historically had distrust of the medical system. What do you think the agenda is of these folks that are disseminating this misinformation? And do we know the source?
We know there are several sources. First of all, they're just people that like to spread rumors around, right? To start with that. There are other people, we're living in a world where people like to give their information about their whole lives in a very open and transparent manner, right? They do it through social media. They tell us what they ate this morning. They tell us when they went to sleep. They tell us who they were with. They tell us every place they've gone. And in that process, they also, just share things that they think. And people, depending on who they are, as you say, they're influencers, people listen to them. And that means they also share their misinformation. But we also know that there are people out there whose motive is to not encourage vaccines. So there is a group of people who are opposed to vaccinations. And then there is a group of very nefarious folks that are out there just to cause discontent through the social media effort. These are some of the same people that have interfered in our elections. They go on the pro-vaccine sites and say anti-vaccine stuff, and then they go on the anti-vaccine sites and put in pro-vaccine information just to create confusion so nobody knows what the facts are.
Okay, so just creating a lot of chaos. So obviously misinformation is huge, and we heard Adrienne, people talk about the mark of the beast and, so many of these other conspiracy theories. But some of the other things that's really impacting the African-American community that has been, touched upon, I want to know how important you think these factors are. One issue has come up is the fear of getting sick from the second shot. People have heard these stories about people getting sick from the second shot. And I've heard people say, look, I don't have time off from my job. I can't afford to get sick because I don't have sick leave. And if I get the shot and get sick, I won't be able to take off. Or are you hearing that concern? And if so, how legitimate is it?
Oh, sure. Look, if you don't have paid sick leave, getting, not feeling well and being able to not go to work, of course, is a legitimate concern. Let me tell you what I tell folks when I was practicing clinical medicine. Bad news doesn't get better with time, and neither does sickness. So I can tell you that if you take the vaccine and you just don't feel well for 24 hours, that's one thing. But if you get COVID-19, you're not going to feel well for days and you might die. And it's going to cost you some money. So you choose. And so I tell people, yeah, well, you can decide that, the concerns about a little mild illness, because by the way, it is mild. It goes from just having a sore shoulder to, just feeling odd and not well for 24 hours, but 24 hours is gone.
Yeah.
And it's not a serious side effect. It is your body's being taught how to fight the vaccine. And so people need to understand it in context.
And I'm also hearing a lot of African Americans who bought into this earlier messaging that COVID was an older person's disease and it really didn't impact younger people, and that they've gone 14 months without getting the virus, so they don't feel a need. How do you address those folks who somehow are bought into this? This is about elderly people or seniors. This isn't about, young, healthy people that work out at the gym 3 times or 4 times a week.
Yeah, well, that messaging was, probably reasonable at the time. But what I've told folks from the beginning is this is a disease that is brand new and we are learning in real time. And so, yes, early on, we did not see it being as severe in young people, but that was the original virus. That was the wild type virus. And as this virus has mutated and has changed, it is much more infectious and much more significant in younger people. But again, the solution is a vaccine. And it always was from the beginning once we got it. But we've learned on the fly about a whole lot of things. I heard your earlier guest say that the patients she was seeing, that there was just nothing we could do. And, that's exactly the case. We were just giving people supportive care early on. But over time, we very rapidly learned how to treat people much better and how to treat the complications of the disease much better. There's still no cure. Yeah. But there is clearly a preventive tool, and that's the vaccination.
So the Kaiser Foundation survey found that, a huge percentage of Blacks, 43% were waiting. 14% said they definitely would never get vaccinated. 8% said they would get it if mandated. So if you add those numbers up, that's like 65% of Black folks who potentially aren't vaccinated and have no plans of getting vaccinated. What are we doing in terms of messaging to reach that huge number of Black folks?
We've learned a lot about the appropriateness of both the message and the messenger. So the message counts, making sure that people understand what those risks are and what they're not. And and also telling people, look, this message, like everything else, may change over time as we learn more about this virus or as the disease itself changes. So we need to make sure that people understand that what they heard yesterday might be a little slightly different than what they hear tomorrow, okay? Second thing is to make sure they hear it from trusted messengers. And that includes, physicians that they may know or their doctor or their nurse. We're trying to get clergy because some folks listen to their religious leaders. Some folks listen to musicians. Very young people, the ones that live in on the social media world, they, quite frankly, listen to other peers. Their peer-to-peer education is much more powerful than hearing from an old guy like me. So, it's you've got to target just like people trying to sell you something. You got to target the right messenger with the right message at the right time.
Yeah, I want to bring in now Dr. Moore, John Moore. He's an epidemiologist. He's a professor at the Weill Cornell School of Medicine. He's a friend of the show. He's someone we turn to quite frequently in having these conversations. Good morning, Dr. Moore, and welcome back.
Hiya.
I want to ask you a tough question, Dr. Moore, because you've been at this a long time. There was a man who recently died in Florida from COVID, and his wife was on TV saying that she was still doing her own research. Now, we don't know what that research is, but that's what she said. And she said she had not made a decision to get vaccinated, even though her husband got COVID at work, unvaccinated, and he died. What do you say to someone like this grieving wife?
Well, it's a sad story. I hadn't heard that one, but I've heard many similar people who are dying of COVID who've insisted that they actually had lung cancer and denied that COVID was real, literally on their deathbeds. people get information from really dubious sources. So where is she going to do her research? Is she going to go to bona fide medical websites, CDC websites, hospital-related networks? Or is she going to rely on Granny's Facebook feed? Or is she going to go to Fox News? Or is she going to go to even weirder information sources? And, we're so polarized in where we get our information. I get my information from New York Times, Washington Post, CNN, the medical journals, of course. I know where to go and look for accurate information. But if you don't trust, for political reasons, that those information sources and read all sorts of weird stuff, then it reinforces your existing prejudice against believing that vaccines are lifesavers and COVID is real. It's an insolvable problem in America of today.
Okay, and here's what some people are saying in light of that, John, Dr. Moore, what you said is true. President Biden has acknowledged that there are declining vaccination rates. He knows it's a problem. He knows it's a big problem. And he announced yesterday that he was going to step it up. He's going to step up the outreach. He's going to send people door to door. He's going to set up clinics at workplaces. He's going to urge employers to offer paid time off so that he can reach tens of millions of Americans. Health experts, Dr. Benjamin said, this is not enough. They were like, okay, that's fine, but this ain't going to get it. Do you think the Biden plan, Dr. Benjamin, is the right plan? Is it enough?
They need to do more of it. I mean, they've done a lot of stuff about, increasing people in communities and making sure the vaccine got to community health centers. But they got to do more about making sure that every doctor who can vaccinate has enough vaccine to vaccinate. And by the way, it's not the 30 or 40 patients that doctor's going to vaccinate. They're going to vaccinate 2 people, 5 people, on a given day in their office. We need to make it ubiquitous. So any place you go to get vaccinated, that means health fairs. Now, granted, we couldn't do that earlier in the year because we were sequestered in our homes and we were all worried about going out. But now that we're opening up and everybody's out and about, we ought to be able to do these pop-up clinics all over the country, and particularly focus like a laser on those communities where vaccination levels are very low and the Delta transmission is very high, like Mississippi and Alabama, Louisiana.
One thing we've seen, Dr. Moore, is these states, California being one of them, Louisiana being one of them, offering these huge incentives. You can win a lottery. In Ohio, you can win free college tuition. You can win $1 million. My earlier guest, Adrienne Johnson, said she thought that these incentives were having a negative impact and causing those people who were hesitant to become even more hesitant. What do you think of these schemes to bribe people, to incentivize them to get vaccinated?
I always thought they were pretty dubious. There were ones that were giving out free donuts. I mean, come on. I wasn't impressed by them. I didn't think they'd make an impact. But we have to look at who is refusing vaccines. I mean, the Washington Post today has a really remarkable statistical analysis of which segments of the population are refusing to be vaccinated. And the biggest problem is white conservatives, hardcore Trumpies, dyed in the wool Republican voters, people who get their information from QAnon and Fox News. And, rational outreach to these people isn't going to make a difference. They don't listen to accurate information sources. They're the same people who believe the election was stolen. They'll believe all sorts of nonsense. We've seen videos of nurses, Republican nurses, who say that the vaccines turn you into walking magnets. I mean, come on, it's a crazy country at the present. So there's a significant fraction of Americans who will not be vaccinated, whatever is done to try to persuade them. So it's hardly worth bothering with. I mean, they're going to get a rude awakening when Delta circulates in their areas of the country, in their counties, in their small town America. And it will. Eric Topol was exactly right in all that he said. So they're going to run, but they can't hide in the end. And it really is going to be a nasty shock when in the next few months as Delta reaches out to more and more unvaccinated Americans.
Yeah, I want to bring Adrienne back into the conversation because I want to talk about, I think we have her back, Rashad, right? Yeah. Okay. Great. I want to bring you back in, Adrienne, because I want to talk to we have some of the nation's leading doctors joining us, but there's this big debate that's happening right now, and it's around mandatory vaccines. So you just said, Dr. Moore, that some of these people are hopeless. We're never going to reach them. We can give them $1 million. We can offer them free tickets to Disneyland, but they're not going to get vaccinated. So now we see big companies like JP Morgan announce that they're going to do mandatory vaccines for their employees, for their clients, and for visitors to their New York office. I want to get you all's opinion on this mandatory vaccination. Should this be, the way that we get this country vaccinated is to say, if you're going to show up at this job, you're going to show proof of vaccination or else you're going to be sent home. What do you think about that, Dr. Benjamin?
Yeah, and in some communities it will backfire, and in other communities it'll work quite well. You saw Methodist Hospital in Texas, where almost all the people got vaccinated, but they had to ultimately fire 150 people. I would love to believe that we can convince every American to get appropriately vaccinated, but as John said, we're not going to be able to convince everybody, and we're going to have to use a whole range of tools. I find it interesting that the most important incentive, I would think, to get vaccinated is not to die. But that doesn't seem to work in every population in the country.
No. Adrienne, what do you think? You work firsthand with patients who've been sick with COVID. You have a Facebook presence, so you're in touch with lots of people. Do you think mandatory vaccines is the way the country should be going?
No, because then eventually it's going to be us versus them. You're going to have, it's going to make a rift. I do believe you should just make them somehow. I don't know how we can identify ourselves. Maybe when you're going in, I know some people are coming out with apps that will allow you to show that you are vaccinated. And maybe that's just something you have to show when you enter into a building. And if you're not vaccinated, then you have to gown up or mask up, and you have to keep it on while you're in their presence at their location. I don't think mandatory is possible, because you're going to create a us versus them. And it's not going to be good.
What do you think, Dr. Moore? We've talked about federal passports. We've talked about people signing up on a vaccine registry, as Adrienne said, having some way of, sorting out who's vaccinated versus who's not. What are you feeling about this whole mandatory, which a lot of employers, like the Methodist Hospital and others, are really obviously toying around with this idea?
Well, it's being introduced in essentially all the leading New York hospitals from September 1, including my own. So I've already been on Zoom calls to try to persuade employees that this is an appropriate thing to do. Some will not. I mean, the Houston Methodist Hospital was the first to introduce it. It was something like a 98% uptake rate. 150 employees were terminated in the end, but 20,000 were vaccinated. It'll happen in more and more businesses, and more businesses in the entertainment industry will require proof of vaccination. Cruise lines are doing it. International travel, if you want to travel internationally to many countries now, you have to show proof of vaccination or undergo an expensive and time-consuming protocol of testing. So there are going to be more and more negative incentives against people refusing to be vaccinated. And it may be necessary. It'll create controversy. Pretty much everything does, but it might help in getting vaccine uptake higher in key states.
And I know, Adrienne, you said you think that mandatory vaccines will create a them versus us situation in the United States. But don't you feel like, we're already there, that there is this huge anti-vaxxer voice that's pushing a lot of these conspiracy theories, that's telling, a lot of these lies and spreading the misinformation? Then there are people, like the four of us on this panel, who are saying vaccines work and are encouraging people to get vaccinated.
I think it's going to get worse. I just came back from Puerto Rico, and going through the airport and their entry process was very extensive. But luckily we had a great travel agent who we uploaded all of our documents to be able to surpass the detailed screening that they had. So it's going to get rough around here if you're not vaccinated, because you're going to be in long lines. You're going to go through long screenings. It's going to be us versus them. I think it'll be worse if it's mandatory, I mean, I'm vaccinated, so it wouldn't affect me. But I do believe that those ones who are against it, it's gonna cause a great divide where they're not going to be able to, like you said, participate in majority of the things that's going to come up. In which I like to travel, so I'm able to travel because I'm vaccinated. But it is going to cause people not to be able to travel because countries are not going to accept them. You know. So.
No, and that's a good point. And we are starting to see that there are lots of venues now that you have to show proof of vaccination before you even are admitted, or they tell you if you're unvaccinated, you have to sit in a certain section. You definitely have to wear your mask. So there are some penalties for not being vaccinated. Dr. Benjamin, we heard Dr. Topol say he thinks the number one thing the government should do is give that permanent, you know, validation or credential to the vaccines that are out on the market, rather than this temporary use that we see. What one do you think? You know, that is one of the solutions that would help many people move from hesitant to getting vaccinated. And then what would you do? What do you see as the most important single thing that can be done to move people?
Yeah, I think that Dr. Topol was correct that once the FDA moves from the emergency use authorization status to full authorization, that there are many people that will be more eager to get the vaccine. But let me remind folks that the EUA status is fully approved. It is approved by the FDA. It has been found to be safe and effective. Otherwise, we would not be using the vaccine. What the other category is over time and more cases. And it was really designed for small studies where you only had a few cases to look at, and if something looked like it might work, and you had a little bit of data. But think about, we've had millions and millions of people worldwide vaccinated. So the FDA should really be able to move this through pretty expediently and capture that group of people. I think I like to think strategically. So I like to think for the long haul. This is not the last time we're going to be asking people to get vaccinated. We may very well, in a few years, have to tell people they need to get boosters for this if the variants continue to evolve. And we may very well have another emerging infectious disease for which we have to live through this again. I hope not in my lifetime, but quite frankly, we've had so many of these types of outbreaks over the last 20 years. It is very likely to happen. So I believe the most important thing that we need to do is get our communication skills right, build trust in communities so that people are much more trusting when public health authorities tell them that you need to wear a mask, you need to wash your hands, you need to keep socially distant, and you need to take this particular therapeutic, which may be a vaccine. And we need to build that trust right now in communities so we don't live through this again. And that trust does not yet exist at the level it needs to be.
That's such an important point, Dr. Benjamin, and that trust, and I think this goes to Adrienne's point, you can't come into a community, particularly a community that has been plagued by the systemic racism and disparities that we've seen in Black and brown communities, and tell folks to get vaccinated, and then you leave the community and they never see you, because your point is, we may be back at this point 2 or 3 years from now, and you're going to want those people to trust this medical system. So the medical system, the healthcare system, has got to do a whole lot more than just tell people to get vaccinated. They've got to address some of those systemic issues that cause the distrust in the first place. And then people are more likely to believe you if they see you, if they can get access to care, if other aspects of healthcare seem more fair and more equitable, then I think you wouldn't get the same level of pushback that you're getting as it relates to the vaccine. So excellent point, Dr. Benjamin. I'll give you the last word, Dr. Moore. Single most important thing we can do in this moment to move the needle to get more people vaccinated.
Different strategies for different populations. Eric Topol was correct about an EUA being converted into a full approval, but to professionals, it's a distinction without a difference. But for soft refusers, people who just need a bit more persuasion, it could help. So anything that really can help, and it will be different approaches in different populations, all of the above have to be done. I think more and more celebs need to come out. You mentioned celebs earlier. many of them are silent because they're afraid of annoying a section of their fan base because it's so controversial. Well, they need to get a bit of guts and come out and do the right thing, whether they lose a few fans or not. Celebrities influence society. We all know that. So more and more of them need to come out and speak up.
Well, I got to leave it there. Thank you so much, Dr. Moore. Always great to see you. Your insights are invaluable. Thank you, Dr. Benjamin. My pleasure meeting you. And Adrienne, stay well, my friend. Keep traveling. Keep spreading that good news on your Facebook page and being a bright light. Your message inspired so many people last year. And I'm just glad to see that you are doing well. You look beautiful. And best of luck to you in all that you are doing to continue to help people, recover and feel good. Thanks again to all of you.
Bye-bye.
Wow. Okay. Delta variant. You've heard it from the experts. It's not going away. In fact, it's spreading. And if it's not in your state now, it will be. And in states like my home state of Missouri, 96% of all new cases are because of the Delta variant. I wish I had better news. Dr. Topol said this variant doesn't have to be scary, but I don't know. Listening to those doctors today makes me pretty nervous about it. And definitely, I think all of us should be rethinking whatever strategy we may have developed over the last month or so as the states were opening up, as travel was opening up, as summer vacation was beginning. We all need to be rethinking how we are moving about the states. Just some words to live by before I get out. I want to say this. Shame on you. Shame on you, healthcare system and the United States government for not making the vaccine available to everyone, to not making it available in ways that they can get it, ways that they don't have to worry about getting fired from their jobs or taking time off and not being paid. They don't have to worry about child care and not being able to take care of their families because of maybe some side effects from the vaccines. And shame on you for the years of systemic racism and disparities that have led us to this point, a point where Black and brown people don't trust medical providers, where they're getting information from folks who've never stepped foot inside of a medical school or research center, and they find those people more influential and more credible because of the years and years and years of systemic issues and race around race and health disparities that they have witnessed, that they have personally experienced. You can't expect to come in and win people over when it's important, when you haven't been there. You haven't been in those neighborhoods providing high quality, accessible health care. And now look, everybody is paying a price for that. So if you live in Beverly Hills, guess what? You're paying a price for what your government and what your healthcare system did to people that live in Compton and live in Watts. And that's happening all over this country. So if you want people of color to trust the medical system, then everybody should be working to make sure that that medical system is equitable. And shame on you, whoever is leveraging the fears of Blacks and brown people and disseminating misinformation and outright lies about the vaccine and about the virus. Your despicable conduct is causing people to lose their life. There's enough shame and blame to go around. Anti-vaxxers that are, screaming into crowds and screaming on social media and anywhere people will listen, spreading bad information about this vaccine. Shame on you. As Dr. Benjamin said, you say one thing on one side and you say something completely different on another side. Your hypocritical conduct is dangerous, and you should be held accountable because what you're doing is really creating chaos and preventing people from living their best lives, including teens and 10-year-old kids. I hear stories of babies in the hospital with COVID, and oftentimes because their parents, unfortunately, have listened to some of these lies that are being spread on social media. So, we all have a responsibility to help not just ourselves and to help our families, but to help our communities. So do your part. Make sure you are spreading good information, reliable information, credible information, factual information that comes from credible and reliable sources, like the sources that you heard on the special report today. Make sure you're wearing your mask, particularly if you're in one of these states that has these high positivity rates. Make sure you are doing whatever you can do to protect those around you. Because as I always say at the end of this show, we are all in this together. I'm out, y'all. Be safe out there and wear your mask.